Imagine waking up one morning and seeing the world clearly. No glasses on the nightstand, no contact lenses drying in a case, no laser cutting into your eye, no surgical blade, just a specially designed lens, a tiny electrical current, and a cornea that gently changes shape. It sounds like science fiction, but inside research labs, scientists are now exploring a radical new way to correct vision, one that could someday challenge LASIK, one of the most famous eye procedures in the world. For decades, LASIK has worked by using a laser to reshape the cornea, the transparent dome at the front of the eye. It is fast, it is common, and for millions of people, it has been life-changing. But LASIK also depends on something permanent, removing tissue. To change the way light enters the eye, the laser must carve microscopic layers from the cornea. The procedure is precise, but it is still a form of cutting. And for some patients, that can mean dry eyes, halos, glare, discomfort, or structural weakening of the cornea. Now, researchers are asking a daring question. What if we could reshape the eye without removing anything? What if the cornea could be softened, molded, and then allowed to harden again into a new shape? This is the idea behind a futuristic technique called electromechanical reshaping, or EMR. And if it works in humans one day, it could completely change the future of vision correction. To understand why this matters, we first have to understand how vision works. At the front of your eye is the cornea. It may look simple, just a clear protective window, but optically, it is one of the most powerful structures in the human body. Every time light enters your eye, the cornea bends that light and helps focus it onto the retina, a delicate layer of light-sensitive cells at the back of the eye. When the cornea has the right shape, light lands sharply on the retina. The world appears clear. But when the cornea is too curved, too flat, or irregularly shaped, the light misses its target. That is when vision becomes blurry. In nearsightedness, distant objects look unclear because light focuses in front of the retina. In farsightedness, the focus point falls behind the retina. In astigmatism, the cornea bends light unevenly, creating distortion. Glasses and contact lenses solve this by bending light before it reaches the eye. LASIK solves it by changing the cornea itself, but EMR takes a completely different path. Instead of cutting tissue away, it uses electricity to temporarily change the mechanical properties of the cornea. The cornea is not just a transparent surface. It is a living, collagen-rich structure filled with water and charged molecules. These molecules help maintain its shape, strength, and clarity.